Hi, everyone. It's Jean Sachs. I'm the CEO of Living Beyond Breast Cancer. And first and foremost, I hope you're all doing well and staying safe. Today, we are going to talk about CBD, a topic that I know there's a lot of interest in, and we get a lot of questions. People aren't exactly sure how to use it, where to buy it, what symptoms might it be most impactful if you're able to try it. And I'm really pleased that we are being joined by someone who is a true expert on this topic, Dr. Alex Capano. Hi, Alex. Nice to have you. So Alex is going to be able to answer a lot of questions about CBD, and she has a PhD in cannabinoid science, which I didn't even know existed. She is the Chief Science Officer at Ecofibre. And she's also a faculty member at the Lambert Center for the Study of Medicinal Cannabis and Hemp at Thomas Jefferson University, which is here in Philadelphia. So clearly, she is the right person to be talking about this subject. So welcome again. So why don't we just start by having you explain what is cannabinoid science?
So the word is cannabinoid, which no one knows. So I wouldn't expect anyone to get that right on their first try or first 10 tries. But cannabinoids are organic compounds that exist in plants, but typically they exist most abundantly in what we consider a cannabis plant. So a cannabis plant is differentiated into two buckets by our legal system, and it's either considered hemp or it's considered what we call marijuana, and that's because of different cannabinoid content within those plants. But technically, they're all cannabis, so hemp is part of the cannabis family. Cannabinoids are biologically active compounds that exist within the flowers of those plants and are used medicinally for a number of reasons. There's a ton of cannabinoids, but the two most abundant, most well-researched, and most well-used for therapeutic purposes are THC and CBD.
And is CBD and hemp, are those terms interchangeable?
No. So hemp is a cannabis plant that has, again, it's really a legal definition. So it's a cannabis plant that has 0.3% THC or less by weight when it's dried. And because of the way that THC and CBD exist in the plants, if you have low THC, you're able to get a lot of CBD out of that plant. So hemp is a really great source of CBD, but hemp is the plant and CBD is the compound that can be found in all cannabis plants, but is really abundant in hemp.
Okay, and THC is what we consider the marijuana side of the plant?
Well, that is the cannabinoid that is more abundant in what we call marijuana. That's a very charged word, so I always want to give a disclaimer when I use it, but it's just really high THC. So that is the compound that is responsible for intoxicating effects, and is what people call psychoactive, whereas CBD is not going to intoxicate, not psychoactive, and both are used medicinally.
Okay, it's amazing. I'm not going to try to pronounce the word, but I have to say learning about the plant is really interesting. So let's talk about how CBD is used. I know it comes in creams, it comes in liquid, it comes in chewables. So if you could explain the difference and also give us a sense of what kinds of symptoms might it be helpful for those that are impacted by breast cancer.
Well, I'll start by saying that there's a really big CBD bandwagon right now. So it's in so many products. Some of those are appropriate and some of those, in my opinion, are a bit gimmicky because someone won't get anything out of a CBD shampoo, for example, other than clean hair. Won't hurt you, but not worth the extra cost. But typically, they are used effectively in what we call ingestibles. So that's usually an oil under the tongue. It can be even a capsule or a soft gel. That would be gummies or chewables would also be in that category. And that's for absorption systemically throughout the whole body. And really, if you're doing it that way, sometimes it's just user preference. But if you use something like an oil under the tongue, it's going to bypass something called first pass metabolism. So basically it gets into your body faster, but the effects may not last as long. And you kind of get more bang for your buck as far as bioavailability. And then if you have a capsule or a gummy or a chew, a tablet, that is going to have prolonged effects, but it's a delayed onset, and you lose a little bit of the active compounds to your gut metabolism. And then topical application, that could be cream, it could be a salve. Really anything you could apply topically, that's a very appropriate method of delivery as well. You may get some full body absorption that way, but most of it's going to be local. So people use that for targeted areas. And again, there's a lot of other ways beyond that CBD is available, not necessarily useful.
Okay. So if you have, let's say, neuropathy in your hands and feet, would that be better to use the more systemic liquid or a cream? And what about other symptoms?
So I typically advise people to use a systemic delivery method for daily maintenance and ideally prevention of things like flares over time, and use a topical as an adjunct for when things get worse, or just if you enjoy it and you do think it feels better. But it's kind of getting at the source from two different directions. So ideally oral, if you can tolerate it, you like it, then certainly go with that full body route. Topical is kind of second line or a nice additive. But some people just feel more comfortable trying topical at first. And I do think that that's often a really positive experience. And then, they become more comfortable with the products after that. Okay.
And so what symptoms do you think it can be helpful for managing?
So it's the most research that exists is really around pain, and that's all different modalities of pain, whether it's neuropathic pain, pain from an injury or arthritis. We do have some really compelling evidence, and there's been some nice systematic reviews, which are basically when researchers look at all of the different studies that are out there, analyze them, and come to a conclusion that says, yes, these cannabinoids are effective for pain relief. So pain would be number one. And then numbers 2 and 3 that are close followers would be for sleep and symptoms that we would call, anxiety, for mood. So really pain, sleep, and mood. This is about quality of life, hopefully helping people to feel better and then hopefully live better. But this is not something that is, going to treat the underlying disease of cancer or other diseases, for example. And I think there's unfortunately, some bad actors who make those claims, and it's really about symptoms associated with these chronic conditions.
Okay, that's helpful. And how will you know if it's working? And should you expect it to give you relief the first time, or is it something it's more cumulative?
Well, ideally, you're sleeping better, you're less anxious, and you're not in pain, or your pain's at least improved at some point on the pain scale. It should help quickly within 2 hours at most, and that's ingestible because it takes a little bit longer. Topical works very quickly if you're using a good product. The tricky part is finding a dose that is appropriate for you. So I do tell people start low and go slow. And so you may not be taking as much as you need to if you don't feel anything at first. And in that case, just add more. But you should feel relief pretty quickly. definitely using regularly is going to enhance the effects just because it's a very potent anti-inflammatory agent. So using that over time tends to compound the relief that it can provide.
Yeah, that's actually really good to know that this is something that could just be part of your daily routine, not just when you have something acute.
Yes. Yeah. I think that that's really the most appropriate way to use it. And sometimes, add more if there's an issue and you feel that you need to and benefit from it, fine. But I recommend daily use as part of it.
So if someone is ready to go and actually purchase some CBD, how would you help them read the label and understand the difference between hemp oil, hemp extract, full spectrum, broad spectrum, and anything else you want to tell us?
Unfortunately, the industry right now is self-regulated. We don't have a regulatory body that's making sure everybody acts the right way. And that really opens opportunity for people who aren't doing the right thing. There are plenty of companies that are, and I think FDA will give guidance soon, but until they do, again, it's very self-regulated. So to be an informed consumer, it's important to look at the ingredients of the product. There's a lot of products out there that have hemp on the label or say hemp oil or really hint that they have CBD in them, but what they have in them is hemp seed oil. And that's nutritious and good for you and good for your skin, but it doesn't have any cannabinoids in it at all. So if you see hemp seed oil or cannabis sativa seed oil, and you don't see something like hemp extract or CBD on the actual ingredients, that doesn't have any cannabinoids in them. And I do think that there's products that are intentionally misleading. So really look at the ingredient list, number one. Hemp extract is typically what industry is using appropriately to say that these are cannabinoids derived from the hemp plant. And that's also federally legal. So people in all 50 states have access to them. You can travel with it. It's not going to intoxicate you and you're not going to get in any trouble with it. But there's a difference with hemp extracts, whether they are full spectrum or broad spectrum. So full spectrum means it does include that small amount of THC that exists in hemp plants. It's not enough, again, to intoxicate, and it is federally legal, but we do believe that that small amount of THC enhances the therapeutic effects of the CBD and the other compounds, and there's pretty good scientific evidence to back that up. Broad spectrum means that the THC has been completely eliminated. Some people are really sensitive to even that tiny amount of THC, so that could be appropriate. Or if they're concerned about a drug test from their employer or something else, broad spectrum is a good option for them.
Okay, that's really helpful. And what about price point? I've seen a real range.
It really depends on how potent the product is. So you want to see how many milligrams of these active compounds, the cannabinoids, and really CBD is the powerhouse, are in the product. Most products, so look at that if you're comparing. If you see, two lotions for $30 and one has 150 milligrams in it and the other one has 300, you're getting a better deal with the 300. Because that's really what you're paying for. Mm-hmm. Most CBD products are going to be between, $25 and $60. Some of them go higher than that when they're much more concentrated or are larger, so they'll last longer. That $25 to $60 range typically is about a month's worth of use. So, $1 to $2 a day.
Okay. So I see these products everywhere, from pharmacies, supermarkets, other kinds of retail stores. Does it matter? Should people be seeking out a specific place or an online resource, or is it really about reading the labels carefully?
So I think that we'll get to a different place once regulation occurs, but for now, it's, being an informed consumer, trying to find trusted resources online, and that can be difficult because there's a lot of misinformation. So I think the best route for people, especially if they're trying to use this for therapeutic benefit, is to go to a pharmacy. So CBD is carried in some major chain pharmacies, but it was really adopted early by independent pharmacies. So like the mom and pop pharmacy shops, where I did not really understand the level of service that you get at an independent pharmacy until I started working with the independent pharmacists on CBD. That is a group that has really been early adopters. They tend to know more about this than most of the healthcare team. They often carry a range of products and can tell people, this is how you use it, this is how much you should take, and this is what I recommend. So that's a really good, trusted resource that's going to be objective and cautious with somebody who's looking for this. So, making that initial trip to a pharmacy is really the best bet.
Great. I know sometimes it's hard to find an independent pharmacist, but this is a good reason to look for one in your community. And I know that Ecofibre has some specific products that are sold in some of these pharmacies. Can you tell us a little bit about them?
So we have a line called Ananda Professional that is only for pharmacies and practitioners. We do a lot of clinical education that is credentialed and very thorough. So folks can feel confident that if they're buying that, the clinician who carries it has really done a lot of research and a lot of learning and can help guide them. And also there's really a lot of quality control and quality assurance in that. Again, this is not regulated. You want to make sure you're not wasting your money and getting what you pay for, certainly, but also that you're not putting anything in your body you don't want to put in your body. There's no contaminants. So with that product, there's actually a QR code, and you can scan it with your phone, and it will bring up the lab reports of everything in that product, so you can feel not only confident that you're not, being taken advantage of, frankly, because that does happen with consumers, but also that you're putting something in your body that you feel okay.
Yeah, that's great to know. So I know these products are also available at dispensaries where dispensaries are legal, which I now know is a fair number of states. But of course, there is a cost to get the card to be able to access the dispensary. So do you think it's important for people to do that if they're looking for CBD, or are these other vendors just as good?
For CBD, the other vendors are definitely just as good. And in some states, they're arguably better. Some states that do have dispensaries, whether they're recreational or medicinal, have limitations with the products they can carry. And sometimes you can actually get better quality products, more variety, and better prices on CBD outside of the dispensary.
Okay, that's helpful. So for our community who's often actively in treatment for breast cancer, are you aware of any interactions with CBD that they should be concerned about? And should they just let their oncologist know that they're going to add this to their daily routine? Is it important information?
Yes, I think so. Always, inform your oncologist if anything you're using that's a supplement. And, it's tricky with CBD because it's metabolized through a pathway where so many medications are metabolized, and many chemo agents that are commonly used in breast cancer are also metabolized through that pathway. So we get concerned about drug interactions. But what the evidence actually shows is that those drug interactions don't seem to actually occur in any clinically significant way until someone uses a very, very high dose of CBD that we just don't see in these over-the-counter hemp CBD products, or even those in dispensaries. They're just not that potent. So if you use, 10, 20 milligrams a day, the evidence shows that is about 100 times less than the lowest risk of drug interactions. That being said, we have a lot of research to do in my field, and you should definitely talk to your oncologist, and hopefully they'll be up to speed, or they'll get up to speed so they're able to answer your questions.
Great. And are there some ongoing clinical trials looking at this that people could look up or maybe participate in?
Yes, actually, we are partnering with a group of researchers and oncologists to look at chemotherapy-induced pornography in breast, ovarian, and colon cancer patients, and that will be using Ananda Professional full-spectrum products. These are over-the-counter in all 50 states, if that wasn't clear, so you don't need any of those cards, or even if you go to a pharmacy, you don't have to go behind the counter. So that will certainly tell us, is this truly effective for improving neuropathic pain? But also, we'll have a lot of data on safety, drug interactions, mood and sleep changes, if there is any. So I think oncologists and providers in general will begin to feel much more comfortable, because there hasn't been a really rigorous clinical trial on that until now.
Okay, and we'll make sure to link that information on the page, so if people want to learn more. So I just really have two other questions. One is, if you are someone who really wants to try this and you want more information, but your healthcare provider just doesn't know a lot, are there places people can go to educate themselves that you think are reliable?
Yes, there's a group called Patients for Safe Access, and they're a good resource. There's a publication that focuses on a number of different things, but it's called Gossamer. It's a little, it's very editorial, but they really do their research. So they're a good resource. And then also at Ananda Professional, of course, I am associated with them, but we are really the clinical leaders, and we do answer questions from patients and can ideally at least get you to someone locally who can really, really look closely. So that's anandaprofessional.com, and people can always reach out to us there.
Okay, that's great. And we'll link that on the site as well. So is there anything else you want to cover? Did we miss anything important?
Oh, there's so much to say. No, I really think that for the time being, it's important to go to a pharmacist or one of the websites I mentioned to try to get some unbiased information that is clinically sound, and just try products, again, that are topical or ingestible. You don't need CBD in your mascara. I'm sure your eyes look great, but don't need the CBD for that, or in your shampoos. So just, that can leave a bad taste in someone's mouth of, I tried this and, I just wasted my money. So, before spending, just take a little bit of time, and I think you'll be happy that you did later.
Right. Well, thank you so much. I mean, it's so helpful to know that there are products out there that are safe and effective. And I know for the breast cancer community, they're taking a lot of medication, and they're really tearing down their immune system and having lots of side effects. So this is something that I think it's great for people to get educated about. And I hope everyone will take advantage of some of the resources that Dr. Capano shared. So thank you so much.
Thank you for having me.
And I want to thank everyone for tuning in. Remember, Living Beyond Breast Cancer has closed Facebook pages. So if you want to connect with other women, log on to our website. We'll make sure we join you to them, and we will continue to create more resources on this topic. So be well. Thank you.